Believe it or not, dentists can usually predict if you're going to lose teeth within the next 10 years. Not with a crystal ball, but by looking at very few specific warning signs. Most people think tooth loss happens suddenly, like a tooth just breaks. That happens. Or a cavity gets really bad. But in reality, the warning signs usually show up years earlier. Dentists are trained to recognize patterns that indicate long-term risk. And many of those signs appear on exams and especially x-rays long before patients ever notice anything. When dentists evaluate someone's long-term dental health, we're often looking at three major predictors. One of the biggest indicators is the amount of bone supporting the teeth. Healthy teeth need supporting bone. If bone levels begin shrinking, that can indicate gum disease or a level of instability developing.
This diagram shows how gum disease progresses. It starts with plaque building up along the gum line. If untreated, it advances to periodontitis, where pockets form. This leads to bone and tooth loss.
Dentists also evaluate bite forces. Excessive pressure, grinding, or even bite patterns can slowly damage teeth over time.
This shows how the enamel has worn down. It advances to exposing the underlying dentins form. This is often caused by grinding.
Large fillings, cracks, and repeated repairs can weaken teeth structurally. Over time, these become much more vulnerable to fracture. Sometimes patients are surprised when dentists point out long-term risks. They might say, but nothing hurts. And that's exactly the point. Many dental problems develop quietly for years before any symptoms appear. This is why preventative care and early treatment planning are so important, because identifying risks early often allows dentists to stabilize problems before they become more serious. Dentists can't predict the future perfectly, but the patterns we see in exams and especially images often give strong clues about what might happen over time. If you've ever wondered what your dentist is actually seeing during an exam and when looking at x-rays, that's exactly why we built AskADentist.ai. It translates dental findings into plain English so you can understand what's happening in your own mouth and what it means long term. AskADentist.ai, 24/7 on me.
Welcome to AskADentist.ai. Clear explanations before dental decisions.